All right, so this is one of my favorite manual therapy techniques to get the rhomboids under the shoulder blade. I'm trying to keep my big old head out of the film because I just screwed this one up and I'm doing it again. But what we can see here is this is already so much better. But I can hit a trigger point right here, which is going to send her through the roof, I'm sure. But my thumb starts to get blocked. This is a very nice way to release the shoulder blade. And what I want to test is I'm going to go into the scraping technique now. And I'm going to see if when I work on the rhomboids more from a superficial level and not going under the shoulder blades, if it's still going to have a positive effect when I then go back and see if the tissue, the muscle is more supple, and if I can get my thumb, exactly as we see it right here, farther under the shoulder blade. All right, so now here my goal is to really just kind of work on that rhomboid area. Also over the spinous process, because we're going to have some tissue from fascia that is also going to be obviously interacting with the rhomboids. And here we can already see the medial border of that scapula. So this is how I know between the scapula and the spine that I'm going over the rhomboids here. And we already see that the tissue is starting to react. I'm not pushing that hard at all, actually. And you've seen how long I've been working for. So I'm just going to see what type of discoloration I get here. And then after, I'm going to go into the massage technique, the manual therapy technique you just saw. And we can see if we see a little bit of a difference. And if we do, that means that we know this treatment has a very similar effect than the actual manual therapy treatment when I'm trying to slide my thumb under her shoulder blade and go deeper into those rhomboid muscles. So let's see, is there a difference? I would say no. So that, I mean, obviously it's feeling better because we opened up the tissue through the scraping. And also, we've done this a little bit before, but the nice thing with this exercise is one can easily do this with 2 tennis balls on the floor at home. And it is the same thing, if not even better, because then they can do it more on their own versus me doing it once a week or whenever they come. But it's a little bit better, but it's interesting to see that the correlation between the 2 treatments are not similar. So I would argue, depending on the issue the patient is having, both would need to be done, or at least one of them, depending on which pain they are having.